Hello, this is Petra Lewis here. First of all, thanks to all of our authors and editors who've been working incredibly hard to make RadExam a very high quality educational resource. I just wanted to go over some of the most common issues that we have found when editing questions to help you improve your item writing and editing skills further. The first area is in the topic title, which sometimes is not specific enough. Now, the more specific these are, the more it's going to help us put these exams together. So to show you an example of this, in this question, the topic title was just trauma. We can search on trauma. It's one of our pathophysiological categories, so it'd be more helpful perhaps if this question topic was something about management of this specific fracture. The second area is in assigning the correct Bloom's level. Now, I know that this is not familiar to many of you, and I would highly recommend that you go to the RadExam website where you'll see a number of resources and guides linked from the home page. If you click on those, it's going to come up with this menu here, one of which is the Bloom's taxonomy links, and you can look at some resources in there. But just to run over them briefly for you, particularly as they pertain to ExamWeb. So the Bloom's taxonomy of learning objectives are shown here. There are 6 levels. And here are some verbs that are associated with them that can sometimes help you define the correct level. So level 1 is remember. This is basic factoid type question. Level 2, understand. So something like explaining an idea. So for an example, in multiple choice might be giving the appropriate staging to a description of an abnormality or identifying some anatomy on an image. Applying is using information in new situations, and the majority of our image interpretive questions will fall into level 3. Level 4, or analyze, is drawing connections between ideas. So we've taken this to mean something like you interpret the image and then you have to make a management decision based on it. Level 5, or evaluate, is a few questions, and this might be something like there are complex MR protocols perhaps, which somebody has to distinguish between them for the assessment of a particular patient scenario. And then level 6, these are probably not going to be tested in a multiple choice scenario, which is create. The next area is R level, or assigning this particular question to the appropriate resident levels, and we've found that sometimes these get to assign to R1 through 4 and fellow. This is just going to make putting the exam together a little challenging. Now, there are occasions when you really want to do that. For example, a patient safety question that you're planning that is a sort that we might give to all R levels. But generally speaking, we really want you to try and stick to 1 or 2 R levels if at all possible. Moving on to the structure of the question, we are not going to accept any questions that are negatively worded. So all questions should be in the form of a single positive answer question. Although questions that are negatively worded, such as the one I'm going to show you here, are very easy to write, and they do mimic to some degree the sort of discussions we have with residents at view boxes, they test very badly. And that's because a lot of residents, and we know we've all done this, miss out the word accept or never or least likely. So we really try to avoid these, and we will ask you to rewrite one if one is in a negative format. No questions that include one answer option being all of the above or none of the above will be accepted. Again, these test very badly. I'll give you an example here. So in this particular question, option E was all of the above. So these again need to be rewritten into a single positive answer format. The cover test is a concept. It's a little difficult to understand at first, although I've noticed that many of our editors are really getting very good at spotting questions that do not pass the cover test. Basically what this means is that if an expert was trying to answer this question, he knew everything about this topic, they could not possibly get the question right if they covered up the answers. Not the image, they're allowed to see the image if there is one, but if you cover up the answers, they could not get it right. And we see this, unfortunately, quite often. And this is a typical sort of stem of these questions, and they nearly always say, which of the following statements is true? In here regarding adrenal myelolipoma. If you covered up these answers here, there is no way that you could answer that question. You don't know what they're talking about. And so really these are a series of true-false questions, and again, they don't test well. if you look at when you look at the answers on one of these failed cover test questions, they usually have very heterogeneous answers. Here we're asking two questions that relate to the imaging characteristics, one about the physiology and one about the pathology. These are a little challenging to rewrite, and what you need to do is take one of these topics, for example, just the imaging features, and then talk a little bit further about those and ask specifically about this topic. Here's another example. Which of the following is associated with bowel-containing inguinal hernias? Again, you have no idea what they're talking about when you're looking at it. But you could ask a specific question that relates to perhaps the anatomy or the etiology of inguinal hernias in a separate question. Another common problem that we see is so-called cluing or cueing. And what this is when the question is structured in such a way that the smart test taker can get the answer right by looking at commonalities of words between the stems or within the answers, even though they don't know the answer. Conversely, they may be led to the wrong answer from the same things. So there's a number of different ways that cluing can happen, but one very common way is the repetition of words in answers. So to give you an example here, risk factors for NSF include all the following except. So first of all, this question obviously is negatively worded and we wouldn't accept it. But two of the answers you see here are administration of base contrast agent. Well, the smart person is going to key into here and consider that, well, since they've done the same, pretty much the same answer twice, all by one word, it's going to be within that. So one way that you can avoid having cluing when you have pairs that you really need to have in here is perhaps you might have one pair here, administration of contrast agents, and perhaps you'll have another pair here which also repeats the same word or words in two answers, so therefore there are two pairs and they can't be clued into it. We're trying as far as possible to have the majority of questions in a fairly standard format. Realize that this is, cannot be across all different subspecialties, such as professionalism, for example. It's going to have a very different sort of format. But we are trying to mimic to the most degree the sort of format that the residents are going to see within their ABR exams. We do see a number of questions that have no clinical scenario whatsoever, and we're trying to include at least a brief clinical scenario, realizing this is somewhat slightly artificial because that's how we read our studies in clinical practice. So a question like this, which just says what is the most likely diagnosis with no scenario, I think is a little suboptimal. This is basically what's this. This question, for example, though, however, has a nice little brief example. I've not included the full image here, and is in a standard ABR type format. Similarly, talking about format, we do want to try and have as much possible standard lead-ins. The lead-in is the actual question that's being asked. And there are a number of different standard lead-ins depending on the question that's being asked here. What is the most likely diagnosis? What is the best interpretation? What is the next best step? What is the most appropriate management of this patient? All pretty standard. If normal is included in one of the diagnostic options, then it should be best interpretation, as normal is not a diagnosis. You don't really need to say what is the most likely diagnosis based on these images. That's kind of superfluous. The next concept is linearity. You may well have seen in a lot of the feedback that comes from me as final editor, I say something like minor linearity change to STEM, and you may have wondered what that meant. The issues with linearity is when the information is presented in a nonlinear fashion, which makes it harder for the test taker to understand what's being asked. Here's an example of a nonlinear question. The risk per radiological study for developing NSF with patients GFR less than 30 is approximately. There's a couple of issues with this. One, it doesn't end as a question. And the first is that the test taker has to kind of go back to this after reading this to be able to understand the question. So we can alter this order around so it's much easier for the test taker. Generally speaking, a linear presentation of data will include patient demographics, 54-year-old woman with a history of COPD, presenting with increasing shortness of breath, period, She undergoes a contrast-enhanced CT period. What is the most likely diagnosis? So for a clinical scenario, this would be a standard linear format. This one is not in a clinical scenario, but you can still put it in a more linear format. So what you give is you give the history. In patients with a glomerular filtration rate of less than 30, then you ask the question, what is the approximate risk per radiological study of developing NSF? And this might seem like a fairly minor change, but when residents are doing multiple questions in an exam, it really makes a difference. I've also moved the percentage from all of the answer choices. By asking a question, rather than leaving an open statement, such as here, it avoids a whole bunch of errors that can be provide cluing to the resident who look for answer stems that don't grammatically fill this sentence. It doesn't really apply here, but it does in more verbal text questions. The next issue is occasionally with image quality. The majority of the images are very high quality, but we have seen some low quality images coming through, such as this one. If you have an image like this, or you are editing a question with an image like this, please don't accept it. Either replace it with a much higher quality one, or contact the author and ask them to. Image copyright, and this has mainly been due to questions that have included images that have been downloaded from the web, and this is obviously we don't have the copyright on these. We shouldn't be using these, and also we really shouldn't use questions in an exam that the residents can readily access. Now, how do you know if an image has come from the web? Well, if you're worried about your image or an image within a question, and I would really try and encourage people to sort of check this routinely, you can do this. When you've got an image that's open in RadExam, either by clicking in the editing window or when you're just viewing the image, if you right click, it will come up with a box that's similar to this. This works extremely well in Chrome. It will say one of your options, search Google for image. If you select that, it will very quickly come up with a list of images that you can just quickly check and see whether they're readily available. It's just sort of one click. It takes about 2 seconds and you'll know whether this is out there and on the web. If it did come from the web, that image needs to be swapped out, or we have to delete that question. And then the final issue is that no explanation is given. Please, authors, add just a brief explanation. We want to use this as a teaching resource as well as an assessment resource for residents, and allowing them to be able to see that explanation is very helpful. Editors, if one isn't there and you can quickly edit it and just add it in, that would be terrific. Thank you very much for listening. As I said, there are more resources available on the RadExam homepage, and please don't hesitate to email me with any questions.